Good afternoon, everyone, and welcome to Ask Her, addressing disparities in Black women's mental health. I'm Sarah Weatherby, Director of Communications at Washington Area Women's Foundation, and I'm super excited to be here with you all today. As we come together for this important conversation during Black History Month, I want to extend a warm welcome to each of you, especially to those who may be new to joining us for the very first time. The Women's Foundation is a community supported foundation that invests in the power of women and girls of color in the Washington, D.C. region. Through grant making and advocacy, we drive transformative change by amplifying the voices and experiences of women and girls of color and collaborate with partners to influence policies and philanthropy with a focus on gender and racial equity. Today, we are here to confront a sobering reality. Black Americans are 20% more likely to experience serious psychological distress compared to their white counterparts. And within this demographic, Black women in particular suffer a disproportionate impact on their mental well being. Throughout history, Black women have been leaders in movements for justice, equity, and empowerment, demonstrating remarkable resilience in the face of adversity. However, we cannot ignore the ongoing challenges they often face, including intergenerational trauma, anti Black systemic racism, and microaggressions. Before we begin, we encourage you to engage with us and share your comments in the chat. We also encourage you to ask any questions you have for our panelists using the Q&A function at the bottom of your screen. And at the end of this discussion, we'll take a moment to answer as many of your questions as time allows. And finally, if today's conversation inspires you in any way, we invite you to take action with us by considering making a gift at thewomensfoundation.org/askher to help us continue our critical advocacy and funding efforts. Thank you once again, and I'd like to pass the mic over to our moderator for today, Dr. Tamara Wilds Lawson, President and CEO of the Women's Foundation.
Thanks so much, Sarah. In this month dedicated to celebrating the resilience and contributions of Black folks throughout history, it's critical that we shine a light on the often overlooked mental health disparities among Black women in particular. These issues, while sometimes sidelined, are deeply impactful and require our attention. Today presents a unique opportunity for us to engage in a meaningful conversation to recognize the obstacles faced by Black women in accessing mental health support, and to explore strategies for fostering more inclusive and supportive environments. By the end of our discussion, my hope is that we not only raise more awareness about this critical issue, but also identify actionable steps we can take individually and collectively towards addressing these disparities, because Black women's mental well-being must be part of the comprehensive healthcare model we deserve. Before we begin, I'm so excited to introduce our featured guest for today, Dr. Tiffany Munford Dent, licensed psychologist and owner of Munford Dent Consulting and Psychological Services, LLC. Dr. Dent is a licensed psychologist in private practice and within a psychiatric hospital. She also serves on faculty at an Ohio-based university within its School of Medicine Department of Psychiatry. Dr. Dent's primary areas of interest include sexual violence prevention and intervention, the role of intersectionality in the lives of Black and Brown girls and women, racial trauma, social justice work within the mental health profession, DEI within social justice organizations, and culturally informed therapy practices. Dr. Dent owns Munford Dent Consulting and Psychological Services, LLC, providing ongoing mental health consultation, assessments, DEI, and systemic change work with mental health and social justice organizations. And recently in 2023, she expanded her clinical practice to include therapy services focusing on Black women and adolescents. In December of 2022, she co-founded Living at the Intersections Incorporated. I love that name. A nonprofit organization focused on meeting the needs of Black girls and non-binary youth and Black emerging adult women. Welcome, Dr. Dent, and thank you for being here with us today. Are you ready to get started?
Ready. Thank you for having me.
You're so very welcome. And I mentioned to you I was going to take this point of personal privilege. I think one of the reasons that I am so excited about this conversation is because I have been in therapy myself for 20 plus years. It is something that I value deeply. And it's something that I came to at the recommendation of two men in my life, a mentor at the
Mhm.
time, and a good friend who is still going to therapy himself. And they both recommended that I use it as a tool to enhance my life and they called it a tune up at the time. And since then, that's how I've used it, but it's also come in handy during crisis. I wanted to mention that because I often think when people they hear about therapy, they think it's something that you've got to come to or engage with when everything is falling apart.
Mhm.
And I feel blessed and lucky to have been able to start that journey in a way where I was able to ease in. And to that point, I'm interested in learning about your journey to this work. I'm not sure how much people understand how challenging it is to attain and maintain credentials in this sector. So, can you talk a little bit about what inspired you to become a psychologist?
Um, Thank you. In the eighth grade, of all places, I was watching a movie, and the movie was about mental. It was a mental health movie. It was telling the story of a person who had experienced, a woman who had experienced significant trauma and was going to therapy. And the idea of finding a place where someone could kind of help you work through trauma experiences, just how the mind works when it's trying to process trauma was very intriguing to me. So I went home and I made the lovely mistake of talking to my supports and saying, I want to be a psychologist. Not knowing that the person in the movie was a psychiatrist, but I said, I want to be a psychologist. This is what I want to do before I knew what it would take. And so then I found out this will take me a decade at a minimum between undergraduate and graduate and residency and fellowship and licensure before I could become a psychologist. So I then told my mother, I said, I don't think I want to do that anymore. And her response was, you said you want to be a psychologist. So you will be a psychologist. And so that speaking that affirmation into me, but also that holding me accountable, that just because something is going to take longer than you thought, it still is your passion, that you need to go for it. And so, that decade later, after high school, a decade after high school, I became a licensed psychologist.
I love it. And I can only imagine the pride that
Yes.
your family felt
Mhm. Yes.
when you came to that milestone in your journey. That's beautiful. Thank you for
Mhm.
sharing that with us. And
Absolutely.
through that story and also the bio that I read, it's clear that your dedication to mental health advocacy and support for
Mhm.
the Black community, like it's a core value of
Mhm.
yours. Do you believe there is enough focus among mental health professionals, your peers, about disparities and barriers to access for Black women, girls, and families?
Absolutely not. I think the difficulty for Black women and girls is that they inhabit two different identities that often take precedent when we're starting to have mental health conversations. So when we are talking about access for women, we focus on white women. So we're not looking at Black women. So we're saying, how do we meet the needs of women? But we're not thinking of Black women when we're talking about women. When we're talking about meeting the needs of the Black community, we're talking oftentimes, even Black women do it too. We start focusing on Black men and boys and their needs and how they're in crisis. And so when we're looking at even services and funding and just priority, we get lost. I think that we are also beginning to have more conversations for Black women. I think COVID did that somewhat because Black women began to say, I need therapy. I'm recognizing that the things that I use to avoid, distract myself from what's been going on in my life, or using my accomplishments as a testament to why I was okay when I was not okay. I'm not having as much access to those things. We began to say we need therapy. And then we started looking around and say, but who's going to do it? who's going to fully understand my experience. And then we began to say, we don't know. And there's no one really here to do that. So I think there is this ongoing struggle that even when we're talking about culturally informed practices and meeting the needs of community, Black women don't ask for it for Black women. We ask for it for our sons and our husbands. When we're talking about women in general, we're not wanting to have that conversation about, that differing experience for Black women. So I think we do a very poor job. I think we're trying to do better. We're having more conversations, in part because Black women are demanding that we do.
Yes, we are. And it is at a crisis point.
Mhm.
And that is unfortunately when we tend to, right, start
Yeah.
paying attention.
Yeah. And I
Uh,
think for Black women and ourselves, yeah, we waited until we began to get to the point where this is not working anymore. And so we began to say, we need support and and acknowledging that therapy is something that could possibly help in those crises.
and I'm interested in hearing your perspective on this. You know, the narrative around heart health,
Mhm.
right? Around, you know, breast cancer
Mhm.
screenings,
Mhm.
around, the connection between dental care and heart health,
Yes.
right? And all of those things are articulated as um, necessary
Mhm.
for you to thrive and be a healthy human. And what is your how do you communicate to people that their mental health, right, is should be thought of on the same plane with those other aspects of health? Like, do you have a tagline? Is there something that you tell your clients that sticks with them? How do we get more people to understand the value of mental health care?
One of the things we talk about is there's this like mind body connection, right? That if you are going through things emotionally and you choose not to address them, your body's going to let you know. We know that stress hormones are a real thing. And so if we're having all of this anxiety and how those stress hormones are going to impact our overall physical health, our immunity, if we are struggling with anxiety, depression, and we're having difficulty sleeping and eating, that those things are going to manifest themselves in our physical health. Like we can't separate the two. We try to do that, but I look good, but it's like, your body is also going to tell you, and it's going to break down on you if you are failing to kind of address how those hormones are processing throughout your body, how anxiety and depression and failure to manage stressors. Your body's going to tell you. And that's one of the things I've found sometimes with Black women is they're like, I am tired. They end up in emergency rooms complaining of physical problems. And then the doctors are saying they're psychosomatic, which is that idea of there's not a physical basis for this. Your body is reacting in a way that's physical to signal you that something is wrong, but there's not an actual physical health issue. And so we end up in emergency rooms. We're sitting here saying, my chest is hurting, or, I'm losing weight, I'm having difficulty sleeping. And our body is then telling us that this is that connection that we talk about. And so I will often tell women, don't handle your mental health. Your body is going to begin to handle it for you, and it will begin to shut down as well.
Thank you for that. I appreciate it, and it's real. I've heard it from
Mhm.
so many peers, right?
Mhm.
That's stress shows up. It manifests physically, but
Mhm.
it was seeded in trauma, in
Mhm.
conflict, and it's easy to attribute insomnia to menopause or PMS or something else. But you're right, when all of those symptoms are converging and it's not getting better, and folks in the ER and urgent care are saying there's nothing that we can see, something else is going on and requires the same level of attention and care. So I appreciate that. And speaking of it being difficult in many cases to get Black women to be still and focus on care, will you talk a little bit about stigma? I'm curious
Mhm.
to hear from you. In some ways, I feel like stigma is often used carelessly when it comes to the Black community in general, right? That our community gets singled out as a one for whom uh, this is a challenge area. So I'm interested to hear your perspective on that. I'm more interested, though, to hear what you feel we need to do to push through the stigma that does exist in our community around mental health care, around seeking therapy, and just around consistent attention to the needs up here.
And I think when we talk about stigma specifically in our community, there are some issues that are barriers that are understandable, that are historically rooted, that make sense. And then there are other ones that are kind of these false perceptions about therapy. So one of the false perceptions about therapy is the idea that you have to be crazy if you're going through something emotionally. And one of the things I say is, as a community, when we're looking at racial trauma, whether it's vicarious or actually experienced, when we are dealing at, as was discussed early on, microaggressions for Black women, when we're worried about imposter syndrome, when we're looking at gender-based violence and racial violence and just existing in this world, how do you continue to manage all of that weight and think that it's not going to affect you? And so, but we choose to say, if you need that, it has to be crazy if you need it, versus saying, I am struggling emotionally. I am having some mental health challenges. And of course you would, considering the experiences that we often have here. The other thing is, in our community, we have learned to not talk outside of our community about what's going on with us. Don't tell anybody what's happening. Don't acknowledge that there are things that are going on that are causing you anxiety, depression. And so part of that then makes us say, I can't have these conversations with someone. And so we have to kind of be able to get beyond that secrecy, because oftentimes we know when we are having, especially when we're talking about the mood disorders, the anxiety and depression, sometimes that has some basis in community in terms of our experiences with our family, with our friends. And so now we're being asked to go to someone outside of them and have these conversations. Some of the other things that understandably why we don't seek services, as mental health professionals, we have done a really harmful job as it relates to the Black community. The National Association of Social Work has come out, the American Psychological Association, the American Psychiatric Association have all apologized to Black folks within the past 3 years and said, we did stuff like using our mental health practices in order to justify harm that was done to you. We came up with diagnoses that said you were mentally ill if you didn't want to be a slave. Yes, there was actually, I think it's drapetomania, I think is what it was called. But we came up with diagnoses if you did not want to be a slave. We used our testing to say you were not smart. We have a tendency to have over pathologized you and given you thought disorders, which are definitely present within our community. But to say you have schizophrenia when we are not diagnosing that high level of a mental health diagnosis with other communities who are having the same symptoms. So, National Association of Social Work, they were one of the ones who helped to recruit people for the Tuskegee experiment, were social workers. So we have done a very harmful job to communities of color and specifically to the Black community, which makes an understandable weariness to believe that you are here to help me. And so I think part of it is that we also need to have these conversations in the community and talk about, of course, we are struggling. Why wouldn't we be? And what do we need to do to address that instead of it being criminalized? You'll see sometimes that when we first get mental health services, it'll be within a criminal justice system, right? Because no one cares until you harm someone else. And so we need to have the conversation about mental health, about acknowledging that we go to therapy. And as I told you early on, I went to therapy. As a therapist, how could I not, when I'm dealing with trauma from other people so much, how can I carry that? That we talk about that we've gone to therapy, that we acknowledge, of course, being put through so many things are going to cause emotional suffering and that you need to have a place to be able to do it. We also need to, as therapists, acknowledge weariness about talking to us, and stop saying, oh, we're here and you're not coming. Well, then we need to look at, why are you not? and that we need to acknowledge the harm that we've done, not just in paper, not just in these lovely documents that all of our organizations have put out, but say, what are we now going to do to not just acknowledge this within community, but to also make it so Black people will come to us. And we haven't done a good job of that yet.
So I think that's a great transition to this next question, which is about cultural competence, a concept that is used widely now. In the last decade, I feel like it's become popular, and it has resonance in the healthcare space in general, and given what you just shared about you know the hindrance to access, can you talk about why cultural competence among mental health care providers is so important to ensuring inclusive care? And if possible, maybe elaborate and talk about why that's important specifically for Black women seeking care.
One of the things is that I've always struggled with our use of cultural competence, because to me, you can never become competent in a culture in which you can leave outside of that culture and still be your authentic self. And then the piece of it is that in a lot of cultural competence trainings, and when people say they're culturally competent, they're learning about a community, but oftentimes they're looking at every stereotypical thing about the community and they're checking boxes. And so when a client comes to you and doesn't fit the boxes, you're challenging the reality of that client because they're not fitting the boxes that you know must be true. And so we kind of try to push this idea of cultural humility, this understanding that I must learn about communities that I'm trying to serve. I must learn what resources work for them. What are the lived experiences that they have, with the understanding that every time that I come in the room, I can be prepared to be wrong and to change based upon the person in front of me, because their experiences, yes, I may be a Black woman, but I'm a Black woman from a rural community, and that piece of it informs who I am. And so your check boxes, I may not fit all of them, and that instead of insisting that I need to fit into what you've decided I should be and what therapy needs to look like for me, what my goals should be, what my coping should be, that you say, I know some things about this community and I've learned, and I make a point to know what I've heard may work. But when you come in and you tell me that that's not working for me, that I'm okay with saying, let's talk about what does. And I think that being humble is the piece that we often miss in cultural competency, because we feel that we know. Competent means I know. Humble means I am trying to know, and I'm open to being wrong and challenged, and that's okay. So we do know that in our field, we are pushing that more, and this idea of decolonizing psychology, not looking at things from such a westernized perspective, which allows for culturally informed practices.
Cultural humility
Yes.
that's okay. I wish I
Yes.
could put it on a neon sign and the and stick it on
It-
my wall. That it's yeah, so resonant. Thank you, but I
mhm,
just wanted to make sure if anybody's
absolutely.
taking notes that they that they could write it down.
And so we are in our field recognizing the need to begin to go outside of what has been traditional mental health, because that's part of the not being culturally humble, not being culturally informed, is that the major fields and theories in psychology and in therapy in general are very westernized. They are very white. Most of our primary theorists were white men. And so they come from that lens, and that we begin to recognize and that we have to challenge that in how we provide therapy services to fully meet the needs of Black women. I know Dr. Tima Bryan, who used to be our president of the American Psychological Association, she has been pushing decolonizing psychology. That's becoming more of a movement of how do we take this field to meet the needs of communities of color, including Black folks, that looks at their true experiences and providing therapy in a way that works for them and doesn't come from this framework of goals that are not for us. One of the things we talk about is individuality versus community. A lot of times for Black women, our goals include community, where in traditional therapy, we're talking only about you, and it has to work for you, bump everybody else, right? And so looking at what does that look like, and what does incorporating culturally informed healing practices look like? What does it mean for Black folks and Black women? What does healing mean and look like? And that may not be filling out this lovely worksheet. It may be, you are going to take some time and you're going to do some meditation. You are going to, do your sage. You are just going to go and be in community with other Black women. That we need to look at what that looks like for you and make a point to incorporate it and get insurance companies to pay for it. And that's that piece of it, right? Is that we can be as culturally humble as we want to. We can be as culturally informed, but we need to teach it in our schools and have it a required course. And then we need to also explain to those who are responsible for paying that because I am sitting here with her and we're engaging in meditation, or we are doing drumming, or we are doing some type of, we're doing like more of a griot experience where we're kind of sharing our stories, that should be paid for, because this is what healing and coping strategy looks like for Black women, not filling out this worksheet and being given this behavioral task.
That's beautiful. And I'm sitting here thinking about the times that I did visualization with my therapist, the times where we have focused on, goal setting that is relevant to my personal development. But to your exact point, Dr. Dent, like what is the legacy that I want to leave? What are the contributions that I want to make to my community? And that is very different than the traditional model. And so much of what you shared disrupts all of that. And I'm super curious to hear, as a nice transition, what you think about self-care. I have a specific question about that, but that is yet another concept that I think is almost being used irresponsibly these days. And I use that word intentionally because I believe self-care is so critically important, and it is also a privilege. I view it as something in the traditional sense that not a lot of women, particularly under-resourced and Black women, can do easily. So yet it's essential, I think, to maintaining mental health. So I'm curious to hear what you think about the concept, but then let me ask the question and then you can come at it however you like. What are some of the practical self-care strategies and coping mechanisms that Black women can incorporate into their daily lives to help promote their mental health and resilience? And I'll take another point of personal privilege. This cup glass that you all have seen me sipping from is from the Tabitha Brown collection at Target, and it just says, "Take care of yourself." And I snatched it off the shelf because I was thinking, if I'm in a day where I've got back-to-back meetings and I'm 2 weeks out from my next therapy session, what is a small thing that I can do to remind myself to get up from this desk, right? Take a sip of water, do something that's going to help bring me down. And so that when I looked at that glass, I was thinking that's an example of a small thing. I don't know if you'd recommend something like that, but that's what I had in mind. Like, what's accessible for Black women, something that we can do on the spectrum of self-care.
And I think that's the couple of things that are the primaries that you've mentioned. One is self-care is about self, right? It is about prioritizing you in that moment, that it's something that brings you joy, that decreases your stress, that makes you happy, that gets you excited, that brings on any of these wonderful emotions. And that it has to be about you. And I think sometimes when we talk self-care, it's not about us. The primary person benefiting from it is someone else. It's like, oh, I'm going to my kid's basketball game. That's self-care. No, it's not. It's supporting your child, which is absolutely important. So the privilege piece of it, I think, is that we have unfortunately monetized self-care as Black women. That it has to be something lofty, right? Self-care is me going to brunch. I love a good brunch. Take it every day, right? But brunch ain't cheap, right? So brunch is self-care. Getting my hair done which can be very expensive, my nails, going on a vacation is self-care, right? Um, and those, when we put it out there, it becomes something that's not attainable by many, and it becomes something that's not often doable. That becomes something that you plan for, right? It's out there. It's okay, I'm self-caring once a year, every 3 years, because I'm going to save up this money for this trip. So part of it is that we need to begin to look at self-care on a continuum. That we from free to lofty, right? And then be able to identify what these free things are. And then also not just free, but the amount of time. Because then we'll do stuff, we'll say, even if we're doing something that's not costly, we're doing something that takes 4 hours, 8 hours. And then we say, we put it off as well because we don't have the time for it. So I'm always one that says self-care things should go from free to lofty, whatever lofty looks like for you. And from 5 minutes to however many days you want. But that you should have this continuum of things that bring you joy, bring you peace, are calming for you, make you happy. And so I do things like, I know for this lovely 50th year, I've asked people to give me 50 things that cost less than, 25 things that cost less than $50 that I can do, because I'm like, it needs to be accessible and I need to be able to do it. But some of the things are like, even if I'm taking 5 minutes for myself, right? Just to sit. Because sometimes Black women, stillness is self-care. Because we never still, right? Stillness is self-care. Rest is holy, right? And so even if I am going to take 5 minutes for myself and do nothing, I am going to sit here for 10 minutes and listen to this song, and I'm going to sing it at the top of my lungs in my car on my way, wherever I need to be. Is self-care, something that brings you joy. And so we need to identify that time is a privilege, and we recognize that money is a privilege. Self-care should not be either of those, should not be a privilege. It should be your right. It should be an expectation. And so I always encourage people when they give me this, oh, I'm going to get my hair done. Well, that sounds expensive and takes a lot of time. What is something that you can do in 5 minutes that brings you joy? What is something you can do in 10? What is something you can do that's free? Because if it's free and it doesn't require a lot of your time, you're more likely to do it consistently because you don't have to wait on it. So that's one of the things I'm always encouraging us to do, because we have monetized it. We have made it a privilege. And I love hashtag self-care, but thank you, Turks and Caicos, and that you there for 2 weeks and saying hashtag self-care with your nails and your hair done and your new outfit. That is not as attainable for most. And it's also not something you can do often. And Black women deserve self-care daily. Again, even if it's 5 minutes.
What was that? We deserve it when?
Daily,
Right.
even if it's only for 5 minutes.
That's right. That's right. I am so grateful. I started writing it down. I was trying to stay focused, and I was like, I gotta take notes. I don't want to have to rewind back through the back through the webcast to capture that. Thank you so much. And I can tell from folks throwing notes in the chat that really resonated with others. And I'm going to hold on to that. Free to lofty. It could be a song, right? That you listen to. It could be an image that you pull up on your phone or your laptop, like whatever you need to help you be still. If you couldn't tell, I'm really, I'm grateful for that. Thank you. And so I think one of the last questions I want to ask before we always want to make time for folks to ask questions, but I'm really committed to that today, even more than we typically do. So I'm going to make this the last question that I ask to make space. As we strive for greater mental health awareness and accessibility, it's essential to consider both the individual and community level efforts. Leaning into your expertise, could you outline some actionable steps that both individuals and communities can take to create more supportive environments? I think addressing, again, that stigma issue, and advocate for policies addressing the unique mental health needs of Black women. Before we jumped on, we were talking about the way that the system is set up that doesn't necessarily lend itself to more folks accessing. But what are some of the collective solves, and what are some of the things that we can, those of us who have the time, the ability, the platform to advocate, how can we help?
I think one of the things individually is the acknowledgement, right, that we deserve therapy, the acknowledgement that as Black women, we face a lot of challenges, both from gender and that at that intersection of gender and race, um, that we are open about saying we go to therapy, right? And sharing our therapist like we do our hairdresser, right? So when someone's in here like, oh, you look so calm and like you're doing well, girl, it's therapy. I have a great therapist. Like we need to kind of have those conversations. I know we're always talking about, people are always saying, check on your strong friend. And I say we need to check on all of us. And so, we always need to be okay. And I think as Black women, part of it is truly having those authentic conversations and checking in and making space, and not so much talking about how strong and resilient you are. Because even when we talk about resilience, the definition of resilience is that you are able to cope and overcome trauma, tragedy, obstacles, right? And so part of it is we should also say, how do we engage in resistance? It's we need to also say we don't deserve trauma, tragedy, and obstacles, and that we also need to look at these systems and within our community that are kind of forcing these things upon us and say, how do we individually and collectively change that? I think we also, as individuals, if we are seeking therapy, we need to ask for what we want. We don't do that. We'll finally go and we don't say, I want a Black woman therapist. If that's what you want, that's what you ask for. Because even within our larger systems, it's like anything else. Whatever is being asked for, organizations are going to seek. So if you're just saying, I want a therapist, they're going to give you a therapist. And then when we don't show up because we're sitting here and saying this person thinks they know more about me and my experience than I do, or they're coming from a framework that is not culturally informed, they say, see, Black women don't want therapy, and they blame it on us because we didn't go in saying what we need. And so part of it as an individual is being able to go in and say, I want a Black therapist, or I want a therapist who knows about this or uses this approach. So when we're individually seeking, we need to also ask for what we want. Um, I think I love conversations when Black women have these deep, authentic conversations where we actually are asking, and I'm developing like this list of cards to kind of guide these conversations around mental health. So Black women can begin to ask each other these questions that are more than, hey, how you doing? And, our response is, I'm good. Or I don't look like what I've been through, right? So we have these like pat answers that do not allow for these authentic conversations about how do I know if I'm well, and to kind of educate ourselves on mental health. As a community, I think having forums where we're having these conversations about mental health within all aspects of our community, within our faith-based community, which we often do not, within our community centers, within our barbershops, within our beauty shops, that we're actually having these conversations and making space for where we are to talk about what is going on with us as a collective, and then demanding in terms of policy and from these systems access to the services that we need. And that access is multifaceted. One of them is making it affordable. As was talked about at the beginning, mental health is healthcare. It has to be included in that. And even within healthcare, we don't make that affordable for most. And so we have to be able to make it affordable, make it available. We have to support those entities as a community that are set up for us. As I told you early on before we started, I sit on the board of Ascension Psychological, which is a men's community mental health clinics that was designed for Black folks in DC. Like Dr. Satire Streeter Corbett was intentional about setting up this space that she wanted to meet the needs of our community. And so we have to kind of, as a community, support when we're able to find those spaces, whether it's through our financial support, whether it's through our recommendations for people to come there, that we are supporting the places that are being designed for us. We also must, when we're looking at mental health services, that when legislators are adding things into healthcare, when they're doing these lovely things, oh, we're in crisis, right? They'll say we're in crisis, and actually framing mental health more as that need that our communities deserve this. And when you're doing legislation and you're sitting here and saying, I got all this money to pay for prisons, and I have all this money to pay for policing and putting police in schools and all of that, but we're saying that a lot of times the root of these things are what is going on with us in terms of our mental health. What does the funding look like to do prevention and intervention related to mental health for my community? And so we have to ask those questions, make sure that we're supporting the people who are actually trying to put legislation and policies in place to meet the mental health needs of our community.
That was a word on so many levels. Thank you for that. And I'm so grateful that this is being recorded so we can all we can all come back to the nuggets that you're dropping. And a question was asked by Ruth in the chat that really gets to the pipeline issue. The specific question is, given how long it takes, and she says in caps, to grow licensed psychologists, therapists, are there subclinical models available? And she says, my experience is that Black therapists in particular are overwhelmed by demand, right? Like it feels like, and please share if you believe this is the reality, but it just feels like there aren't enough to meet the demand.
And I will say that as it relates to Black psychologists, we were like 3.75% of all psychologists. We are now 5%, but that includes those of us who are in academia. That includes those of us who are in private practice, who are working in the private practice in multi-levels, like including those who are only doing private paid clients. So it includes all of us, and that's 5%. I think the difficulties with kind of subspecialties is there's a reason why it takes us so long to provide services, right? And one of the things as a mental health professional that's difficult at times is we recognize that mental health is important, and we're trying to get people to recognize your mental health is as important as your physical health. But at times there is this belief that we wouldn't say, hey, I don't want a doctor, or can you give me someone who's had 2 years of training and to provide my medical care? Because we recognize that we're asking for something that is important and that you need to know what you're doing. So the difficulty is that we have to make sure that we have mental health professionals who are licensed, who have gone through training, and that training is multifaceted. It's not just the degree, they're then supervised by people who are doing this work for years at times, right? Who are there and are making sure that you have learned what you need to learn and are not going to be harmful. And so there is not this shortcut, I think, for being able to get more of us in the field. I know that there have been movements with some universities that are trying to do more of a pipeline approach, because more of us start out at bachelor's level for social work, psychology. I met so many psychology students not understanding that if you're a psychology student, you're in this for the long haul in order to be able to do this work. And so we're trying to educate those students more and mentor those students and do these pipelines into the field to keep you going. Part of that also community is funding, right? Is that, it's expensive. And so part of it is also, as a community, you're saying we need more funding to support these people so they're able to continue their education and able to do this work. But there's not this shortcut. So in the meantime, one of the things that we're having to find ourselves do is look at 95% don't look like me. And so how do I make sure that I'm working in collaboration with that 95% to meet the needs of my community, because there are so few of us, as we're also building that pipeline.
Yeah, given the amount of time that I spent in higher ed, and then that, on the other side of my degree was working on issues of access and retention, it is just infuriating to me how many institutions are not taking responsibility for the culture issues, culture crisis that many of them are complicit in. They're just not meeting the needs of their students of color to ensure that they stay. And that includes not hiring enough faculty of color. I mean, all of the things that across STEM,
Mhm,
across all of the sectors, but I think it's particularly problematic in STEM fields.
mhm,
And so all along the pipeline there are issues, but the folks who are suffering are um, folks who could really, really benefit from having a family or
mhm,
an individual therapist or a child or adolescent therapist, and
mhm,
they're not enough. So I appreciate you
mhm.
naming some of that. And we've got a good, really meaty question from Bree, who asked if you have any recommendations for how folks can encourage employers, especially for Black women in dominantly white workplaces, um, to help us care for ourselves better. I often find myself having to fight for time off or rest. What's unsaid there is I'll I hope I'm not overstepping, but I think what's unsaid is this pressure to feel like you can't, right? That you've got to be, as the Black woman on staff or team, you've got to present as strong, and and asking for what some of your other colleagues might is perceived as weak or not doing your part or doing your best, and feeling like having to show up better than everybody else or more than everybody else comes at a cost to you.
And that's it exactly. I think the thing is your coworkers are taking time off. They are using their PTO, they vacation, they're sick. I just need an emotional day. There is something within us as Black women, understandably, because society pushes this narrative as well, that we are strong and that we have to show up fully and at all times and that we don't need a break. And so there's this kind of tightening in the chest when we're asking for it. Because then it's going to be, see, they already don't think I'm good enough. And now, because I say that I need a day off because I'm tired, that I'm proving their point, because we're not viewed as individuals, right? We are viewed as representing all Black women. And so if I'm tired, it's like, see, we knew, versus when your coworker Janet is like, I need to take the day off because my child is sick. Or I just need to take the day off because I've just been doing so much. And she takes it. And so I would say if you have the privilege of having PTO, take your time off because everybody else is doing it. And it's this difficult place because if we're doing it, we're worried that they're going to say, see, you're not everything we thought. But at the same time, we are then reinforcing the narrative if we don't want to do it for ourselves, for that next Black woman who can't take the time off. Because you know what? Tiffany never took time off. Why are you? But you don't care that Janet, Samantha, and Tabitha, you're not, when Susan comes, you're not comparing her to them because they're all individuals. But then we need to say, if I have this time off, if I have the privilege of time off, I need to begin to take it, because everybody else is doing it as well. And that, again, if we don't do it, our body's going to do it for us. We're going to find ourselves sick, and we're suddenly not going to be able to take the time off to brunch. We're going to be taking the time off and in our beds because our immune system is now crashed because it said, you've done too much stuff to me emotionally, and you're so stressed out that I can't keep up. And then we just need to do it, of course, we have to do it in the appropriate way. We can't just not show up. We have to plan. But part of that is also being okay with planning and saying, this is where I'm at. This is when I'm going to take this time off. If you have it, it's meant to be used. And so we have to begin to be okay with doing that. Because you're replaceable too. They'll let you go.
Yeah. Oh, absolutely. And that actually,
If you don't show up. I mean, if you then get sick and can't
yep,
show up,
yep,
they will replace you.
yep. And something you said, we can hold ourselves accountable, but we can also hold each other accountable, which is
Mm-hmm,
something you called out earlier.
mm-hmm,
It's not just about checking on your strong friends. It's
mm-hmm,
checking on everybody. When was the last time you took a mental health day? When was the last time you actually used your vacation? Like, are you bragging about rolling over your time to the next year? To what end?
And I will say,
Um,
I have an amazing psychologist friend I work with in the hospital, and she will text me, take your PTO. Have you taken any time off? And I'm like, well, take your PTO. And she was like, I take mine. And that was one of the first interactions we had. And she said, I need you to know you have time off and you need to take it. I take mine. And she's very intentional. She lets people know. And that fear is not there because she's not doing anything different than anyone else. And that was her thing. I'm doing it appropriately. I'm doing it the way that everybody else is doing it. I need to be okay with that. And she holds me so accountable. If
Yeah.
she hashtag take your PTO to me one more time. But I appreciate and I need that from other
Yep.
Black women.
Yep. Yeah.
I do.
We absolutely need it. And then there's the notion that if we weren't supposed to take it, as you said, it wouldn't be a benefit. It is
Hmm.
there. It's there for a reason,
Hmm.
right? And so a question, and this is you've referenced it, but I don't think we can talk about it enough. Someone
Hmm.
specifically asked, what is the best resource? And we can we'll tailor it to regional.
Hmm.
And I know you've got ties here.
Hmm.
What's the best resource to actually find therapists for Black women, families, men, children? Now that there are, as we spoke about before the our conversation started, there are virtual options,
Hmm.
right? Which add um, add a layer of access. What should people do? And maybe, if possible, think about someone who's engaging this for the first time, and maybe somebody who's trying to diversify. They've had an individual
Hmm.
therapist and now they're looking for a family therapist. Where should people go? Back when I started it, I asked a family, my good friend's mother, because I knew their whole family was in therapy, and then I asked for a Black woman reference from their therapist. It was very
Hmm.
word of mouth. It
Hmm.
is no longer the 1990s, right? Things have shifted, things have changed. So what do you recommend?
I think I think word of mouth is still one of the best if you can find it, because you're hearing from someone who has actually experienced it and it's working for them, right? I mean, we share our hairdressers, we share where you get that outfit, anything we like about what's going on with you. We like, oh girl, this is where I got it from. So if you have people who, again, having those open conversations about mental health, who can recommend, I always say start there. As therapists, if you come in and someone recommends you, we're going to have a conversation, because just because I was good for your friend doesn't mean that I'm going to be the best for you. But we oftentimes have these loose networks where we're able to refer to other Black folks. Therapy for Black Girls, I know, is one of the sites that people use a lot to kind of find therapist. Association for Black Psychologists, ABPSI. Many of us belong to ABPSI, which is an organization specifically of Black psychologists. National Association of Black Social Workers, the local chapters there, being able to access that. If you have insurance, asking your insurance provider, because I know when that was one of the things when some insurance panels were asking me, they were like, we hear you're a Black psychologist, we need more. And so that's a piece of it too. If you have insurance, if you have an EAP, specifically asking for that demographic. And a lot of times the insurance companies do have that information about who we are. So definitely word of mouth. If you know people and it's working for them, ask them. That therapist, likely, if they can't do it, they have a network of people that they refer to that they would recommend you. Therapy for Black Girls, Association of Black Psychologists, National Association of Black Social Workers are kind of these great places to start, and definitely telling your insurance company, if you have it, what you need.
Thank you for that. I
Mhm.
appreciate those very specific recommendations that people
Mhm.
can follow. This last question, and I've heard this in previous places of employment, and it's a really poignant one.
Mhm.
Sometimes employees don't take advantage of their employer's employee
Assistance
assistance
program.
program because they're concerned about um, the HR department being notified if they are seeking mental health resources
Mhm.
or services. What are your thoughts concerning this fear that HR will be notified? Be in your business, be aware that you may be challenged or suffering or going through a crisis that you don't want everybody else to know about.
I think one of the things is to always find out about the parameters for your EAP. in that contract with the agency that you work with, and asking those questions. What information is shared with the company if I access this EAP? Are they going to know my diagnoses? Are they just going to know that I showed up? What information are they going to have access to? And being very clear on that, because when the contracts are signed as mental health professionals, we often aren't going to say, oh, yeah, they have depression too, because there's levels of privilege and releases of information. But I would ask those questions. It's a benefit and you want to be able to use it, but you also want to be clear. And when you're asking whether it's HR or calling the EAP, because if you don't even want HR to know you're thinking about it, you always can call the EAP because they give you the hotline for that and say, I have questions. If I'm receiving these services, what information is shared with my company? Is it just that I have access services? Is it more specific? So definitely seek clarification, because every contract is going to be different and you want to know what your agency has agreed to see if, hey, do I want to access this, or for me, because they're going to be too much in my business, that I'm going to choose to use my insurance and go elsewhere.
Thank you for that. Yet another very succinct and clear and simple way to address that. Just ask the question, because HR is certainly required to answer it, just like they're required to share the resources, right? So I'll close with someone asked in the chat, how was this relevant to the work that the Women's Foundation is doing? And I will say, both a heartfelt thanks to you for your time and sharing your expertise, Dr. Dent. And we'll say that we view having you here as directly correlated to our focus on Black women leaders. Our report, Thrive as They Lead, talks about how Black women in leadership positions, particularly in the nonprofit sector, have experienced harm, are really struggling to maintain. And folks talked in the report about suffering and about the physical manifestations of the anxiety, right, of the depression, and just feeling worn down. So we thought it was particularly relevant to have this conversation with you on the heels of that. But we also programmatically fund women and girls through YWI, our Young Women's Initiative, through our early care and education work. And in all of those spaces, we have women and girls of color who are in need of support and who need to be reminded to center themselves and take care of themselves first, right? Apply the oxygen mask to yourself first, and then help those around you. So we felt it was just relevant across the board, but particularly had the report in mind, in wanting to have an actual clinician who could talk to us about things we can do and remind us of what we're not doing, because specifically as women and during Black History Month, focusing on Black women, we are so outwardly oriented, right? And that is, I think, one of the things that makes us, one of the many things that makes us beautiful, but it's also one of the things that gets in the way of us taking care of ourselves in the way that we should, because as you said, we deserve it. We deserve health care, right? Comprehensive health care. We deserve self-care every day. We deserve to be healthy and happy, whatever that looks like for us. And I'm so grateful to you and your community of clinicians and experts for fighting the good fight and naming what's going well and calling folks to account for what's not. There's a lot of work to be done, but you are among those actually doing the work and committed to it. And I'm so grateful to you for that. And so grateful that this will exist in perpetuity and people can come back to it and pull out all of those gems that you dropped. And to all of our guests, I really hope, I clearly got a lot out of it. So I'm really hoping that everyone who listened in today felt that the conversation was illuminating and inspiring. Please share what you learned. To Dr. Dent's point, one of the ways you can help yourself and others rewatch this, but then share it, send it to somebody along with the hashtag Take Your PTO. And again, your mental health is something that you should prioritize, something that all of us should prioritize alongside our physical and spiritual health. I hope that all of you will continue to tune in to our future Ask Hers and never miss an opportunity to say, please send some support and resources our way, invest in the foundation so that we can continue to bring you this critical programming and continue to provide grants that invest in the power of women and girls in this region. Grateful to you again, Dr. Dent. Thank you so much.
Thank you for having me.